Hi, good evening. I am Dr. Vishwanath, a physician and diabetologist. Today, in the second video, I'll discuss about basics of detecting diabetes. Everyone must know. So, how to diagnose diabetes and what are the common blood tests are done to know whether person is diabetic or not. Number one, a random blood sugar, RBS. When someone having random blood sugar, that means blood sugar checked at any time, irrespective of the duration of the meal. That's called random blood sugar. If that is more than 200, he is considered to be diabetic. Number two, a fasting blood sugar. The fasting blood sugar is one which is done after overnight 8 to 10 hours of fasting. If the fasting blood sugar is between 110 to 125, he is considered as pre-diabetic. If the fasting blood sugar is more than 126, 125, it's considered as diabetes. Third thing is postprandial blood sugars. That means 2 hours after breakfast. Here, 2 hours from the beginning of the breakfast. That's called postprandial blood sugar. So if you calculate, some people calculate after finishing the breakfast, then it all depends on the duration. Some people will take 10 minutes to eat, some people take half an hour to eat. So postprandial blood sugar is the duration of 2 hours from the beginning of the breakfast. That the value is more than 200, he is considered as diabetic. And third important test is glycosylated hemoglobin, that's called HbA1c. This test give an idea of your average blood sugar in the last 2 to 3 months. If the HbA1c value is more than 6.5, is considered as diabetic. Between 6 to 6.4, considered as pre-diabetic. So earlier days, in the olden days, they're also doing urine test for the detecting diabetes. Now it is not reliable and not valid. Urine tests are not required. The blood tests are more accurate. And the last question is, why a fasting blood sugar of 120 is not diabetic? Why only above 125 is diabetic? See, these values are arbitrary and these values are fixed by ADA, American Diabetic Association, 1978. Initially, they thought that above these values, diabetes complications are prone to happen, so that they fix these values as arbitrary. So it's not so. Many research papers have proven that diabetic complications sometimes happen even in the values less than this, even at a pre-diabetic stage. So anybody who having a blood sugar levels of fasting blood sugar and HbA1c levels in the pre-diabetic stage, they have to be very careful so that they should not become diabetes and develop a complications. So this is about a basics of detecting diabetes. Everyone must know. RBS, random blood sugar, FBS, fasting blood sugar, PPBS, postprandial blood sugar, and HbA1c, glycosylated hemoglobin. And urine test is not required compulsorily. Bye for now. Next time I'll come with a third video on decoding diabetes.